Everybody needs the use of their arms and hands. It's so important. I'm Robin Hickerson, and I had spine surgery at Washington Regional. I came into the clinic because I was having a lot of problems with my left arm, a lot of pain, numbness, heaviness. I was starting to drop things without even knowing that I was dropping them, you know. I'd be walking along and out of my hand something would fall. I had what felt like almost like electric shocks in my shoulder, and I had gone and had an MRI, and they recommended that I saw Dr. Armstrong so that they could try to fix that problem. From the imaging, they saw that C5, 6, and 7 were having issues. C6 was almost just like it was really pinched in between 5 and 7, and it looked like it was like half the size of the other two.
So Robin presented to our office with a history of spinal cord compression from bone spurs and discs that bulge together that all create compression of the spinal cord and nerve roots, which creates pain and dysfunction. It also creates weakness. So with Robin having a diagnosis of cervical stenosis, which is our fancy word for compression of the spinal cord, and dysfunction of the spinal cord, the best choice for her was for an anterior cervical fusion. We operate through a space about a nickel or a quarter in size, bring a microscope in and blow it up so we can see things in great magnification, and then we remove that disc that's pressing against the spinal cord and against the nerves. We'll then take a little high-speed drill and we will shave off the spurs that grow against the nerve hole and grow into the spinal canal, decompressing the spinal cord. When the pressure's off the spinal cord will actually bulge back forward and show you the pressure's off. And then we'll replace that disc with a small titanium graft, like this. The titanium grafts are porous and allow bone to grow through them while maintaining the height of what the disc used to be. When that's done, we'll put a little titanium spacer between those that appears like a clip or a graft that sits between the two bones. It takes the place of the disc, and then we will put a plate and some screws over the front. And that's what we did for Robin, that decompressed her spinal cord and decompressed her nerves, improving her neurologic function and taking away her pain.
Every day is better and better, and it's amazing. I don't drop things just out of the blue anymore. You know, I can be walking around carrying my purse and it's in my hand at the end of the day instead of on the ground. So it's been amazing. It's life-changing.